Hey guys, Dr. Z here. So in preparation for this Valentine's, I wanted to do a 3-video series on the most wonderful miracle of nature, anal. So to fully welcome Valentine's weekend, I wanted to do a small video series on anal care so you and your baby can enjoy the healthiest sex possible. So basically, I believe there are 3 things gay men need to keep off their asses, and that is papillomavirus, anal cancer, and shame. Today I want to start with the topic of shame. One of my mentors during my fellowship in palliative medicine was a very wise social worker, and she taught me that the language with which we express who we are and what we like will play a role in how we think about it. And how we think about it will play a role on how we live it. So ultimately, language is key. So whenever you are using words to describe the fact that you like to be receptive in sex, make sure you're doing it with dignity. How often in a gay group do you feel like the tone with which the bottoms are referred to seems to be demeaning? I find this fascinating because it speaks of the fact that even though homophobia is no longer an accepted behavior, misogyny is very much alive and well and active in gay culture, where being femme and being non-masc for many will be detrimental to their identity, and being the receptive partner in a sexual relationship also gives you a secondary role when it comes to value. And that's where the language that we use and the way with which we refer to our own sexual behavior is key, and we have the opportunity to keep it dignified. I believe one of the first things we need to do to eradicate shame is to understand. So how do we understand the role that the anus plays in sexuality? The first thing to understand is that the anus is a muscle, and it's a muscle that is subjected to both voluntary control and involuntary control. When it comes to the voluntary component of your anus musculature, it's not going to be a weak pelvic floor, meaning a weak anus musculature that's going to allow for easier penetration, but actually the opposite. Well-developed musculature of the pelvic floor is going to be one in which you can exert higher levels of control. How to go about this? The first thing is what I like to call anal mindfulness, and this comes from a great book by Jack Morin called Anal Pleasure and Health that I cannot recommend enough. And what this speaks of is that if you do exercises of breathing wherein during inhalation, when the air goes in, you fully contract the anus, which is kind of that moment at the end of the bowel movement where you, and during exhalation, you relax the anus, meaning you do a little bit of bearing down, enough to relax the muscle fibers. By doing this repeatedly, at least 5 minutes a day, in the subway, in your car, while at your desk, you're going to realize with the passing of the days that you're starting to really calibrate the motions of your anal muscle to breathing exercises, and that's key to gain more control. Next, how do we think about the involuntary component of our anuses? All of our gut from mouth to anus is coated with muscle fibers, of which the majority we have no control. However, they are deeply affected by how regulated or unregulated we feel from our brain downwards. This is the reason why some people have irritable bowel syndrome, because the stress that lies in their brains is affecting the contractility of their non-voluntary muscles surrounding their intestinal walls. When it comes to the anal involuntary muscles, a key will be for you to get to know your body. So my recommendation is when you shower, if you're new to this, keep a lubricant that will not dissolve with the water, like just straight Vaseline will do, and touch yourself. Learn to distinguish between the more external layers of muscle that are the ones fully amenable to your control, and the more internal layers of muscle that are going to be more responsive to the emotional climate of your brain. So therefore, what happens when you fully relax into your breathing? What happens when I fully focalize myself in the outer breath and the exhalation and try to make my exhalation a little bit longer than my inhalation? What happens with the contractility of those muscles that are not fully in my control? And you're going to find your way to relaxation by just getting to know yourself. This has a name in medicine. It's called biofeedback, which is your own gut giving you feedback on how you're thinking about it, and that's key. If these techniques are not enough and you're really struggling and hurting yourself whenever you're trying to go anal, then consult with your physician, because very simple interventions like having a compounded cream made for you with either muscle relaxants or light numbing agents can make a huge difference on how you can relax before sex. If beyond these measures you're really finding yourself in a pickle and you cannot really learn to enjoy anal sex even though you feel that is something you want to explore, do not shy away from visiting your proctologist. A proctologist is a specialist in the area of the anus, and this is a surgical specialist, however, that might have a ton of pointers to give you on how to help relax and how to see if there's any chronic injury not allowing you to fully enjoy this organ for sexual pleasure. So thank you guys. Stay tuned. Tomorrow, papilloma.